Hi, I'm Kelly Villegas from Focus Neuro Rehab, and today I'm going to do a little video on carpal tunnel syndrome. So there's a few ways that we can prevent carpal tunnel syndrome. I have had carpal tunnel syndrome 5 times, and I've been able to get rid of it every time by doing these stretches and activities, okay? So just a little background on the carpal tunnel. The carpal tunnel is a tunnel that is made by a thick ligament that goes from one side of your hand to the other. And all your flexor tendons go through that tunnel, and as well as the median nerve. Now the median nerve goes to these 3 fingers. So you might have numbness or tingling or loss of strength in those muscles of that hand, okay? So I'm going to show you a couple ways that you can prevent this from worsening. I am going to tell you a disclaimer though. If you have constant tingling and numbness, you could probably do all these exercises and it may not help you because it's just gotten too bad. In other words, if you're constantly tingling or numb or constant pain in your hand, you do need to see a hand surgeon. Or an occupational therapist for an assessment, okay? So the first thing I want to show you or talk about is most of my carpal tunnel patients have a lot of tension in their neck and their shoulder. So getting a good deep soft tissue massage into the scapula and the upper back and neck can help a lot with relieving the tension here, okay? You can also do neck stretches, and I'm going to show you a couple right now. If you grab underneath a chair and then slowly tilt your head away from that side so that you're just leaning gently to the side, you should be able to feel all this stretching. Then you can tilt your head back with your chin up. Maybe even extend your chin out. And that's going to stretch the front of your neck. A lot of people avoid that. And then you're going to tilt your head down toward your chest. And then that's going to stretch the back of your neck. Okay? And I would do both sides for that, okay? And the next thing I want you to do is a nerve glide. So this is a brachial plexus nerve glide. The brachial plexus is all the nerves that go from your neck into your hand, okay? So the way you're going to start this is you're going to bring your elbow back. So your elbow should be straight across from your shoulder. And then you flip your hand over like you're holding a pizza. And then slowly glide it out, okay? Now, if you can't get out here without getting tingling and numbness in your hand, then I want you to stop wherever you start to get the tingling and numbness and then come back. So if you can only go to here, that's okay. I just want you to try to loosen it up. We're trying to loosen up that nerve that runs from the neck into the hand, okay? So just like that, okay? And then we're going to do a couple of lumbrical stretches. So the lumbrical is the muscle that does this. It inserts or it originates on the flexor tendon and then it inserts on the extensor mechanism of the finger, which is on the opposite side of the hand, okay? So it does this. So if you do a lot of heavy work with your hands, it is very common to get this problem where the lumbricals are tight. So a lot of people that have tight lumbricals cannot hyperextend their fingers. So if you can't hyperextend your fingers, I really want you to work on stretching out those fingers so that you can get hyperextension, okay? Because if you can't get hyperextension, it's going to be really difficult to do these stretches. So the first stretch I want you to do is I want you to make a fist. And then you're going to bend the fist over, okay? And then you're going to stretch forward nice and gentle. And you should feel a stretch all through here, but especially right on the top of your fingers. You should feel it. Feel the stretch there. And then hold this for about 30 seconds. And then we're going to flip it over. Again, push back, try to hyperextend the fingers, and then stretch forward. Okay, so that's the first one. And the next one, we're going to actually stretch the lumbrical muscles. And so the way you're going to do this is you're going to push your finger into hyperextension, and then you're going to use the base of your hand to push these fingers down, okay? So you're kind of in this type of position with your hand around the finger. And then I want you to bend the finger down and try to dig your nail into your hand like this. If you're not feeling much when you do this one, then I want you to try using it on a table or an armrest. And so what you're going to do is push the finger down into hyperextension, pull your other fingers back, okay, like that, and then you're going to try to flex that finger, okay? Since the lumbrical is connected to the flexor tendon, this is going to stretch the lumbrical, and you should feel pain all around this area, okay? If you don't feel pain, you're probably not doing it correctly, okay? So if you need help, just kind of keep watching the video over and over again, because you really want to be able to get those lumbricals stretched out. The reason this is a problem is because those lumbricals are attached to the flexor tendons. Sometimes they kind of migrate because you're constantly using your hand, and they migrate down into the carpal tunnel, which compresses the median nerve tremendously. So sometimes people do have to get carpal tunnel surgery, which is basically they just cut that tendon there or that ligament, and it provides more space for the lumbricals. So like I said, if you have constant tingling and numbness, do see a surgeon or an occupational therapist for an evaluation. But if not, try these stretches, and I hope they help you.